Welcome everyone to this Aging Network training opportunity to introduce new resources to elevate family caregiver programs, hosted by the Administration for Community Living, or ACL's National Caregiver Support Collaborative, or NCSC. We're very pleased and appreciative that you all have joined us today. My name is Leah Moran, and I am the content lead for the NCSC's Technical Assistance and Coordinating Center, or TAC, as you'll hear today. Today's event is intended for entities involved with implementing and operating programs funded by the Older Americans Act. Here is an overview of the topics that will be presented today. I'll begin by orienting us to some key information to consider throughout the event. ACL will then provide opening remarks before we move to a presentation about the NCSC TAC. Then we will hear from representatives from each of the NCSC grantee projects about their work. And finally, we'll allow time for a Q&A session before we conclude. So we'd like to once again welcome you all and familiarize you with a few Zoom features and information relevant to today's training opportunity. To submit a comment or a question during the event, please use the Q&A function by navigating to the Q&A button at the bottom of your screen. Any comments or questions submitted will be directed to our speakers. We will respond to as many questions as time allows, but if you do not receive a response during today's event, please know that our team will review all Q&A submissions after the event, and your comments and ideas will continue to inform future training opportunities and other technical assistance offerings. This event provides communication access real-time transcription, or CART, and American Sign Language, or ASL interpretation. To access the CART transcription, click the Show Captions, or CC icon in the Meeting Controls toolbar. And we have two alternating ASL interpreters whose video feeds will be spotlighted while they are actively interpreting. In the coming weeks, we will post the slides and the recording of today's event on the resources page of the NCSC website. So to start off, let's take a look at what you can expect to learn from this event. At the conclusion of the session, you will be able to understand the role of the NCSC and opportunities for technical assistance and your engagement. And then also stay informed on TAC and grantee development through NCSC resources and communications. To ensure clarity as we move through today's content, we want to take a moment to share this reference with some key acronyms that will be used throughout the presentation. ACL refers to the Administration for Community Living. Next, NACSP is the Native American Caregiver Support Program. NCSC, like I've mentioned, is the National Caregiver Support Collaborative. And FCSP is the National Family Caregiver Support Program. OAA refers to the Older Americans Act. And lastly, TAC is the Technical Assistance and Coordinating Center. So now that I've shared our introductory information, we will transition into our main presentation, and I'm very pleased to introduce Jonathan Weston, Aging Services Program Specialist with ACL's Office of Supportive and Caregiver Services. Jonathan, I'll pass it to you to share our opening remarks and provide an overview of the NCSC.
Thank you for getting us started, Leah. And thank you all for joining us for this opportunity to share these very invigorating initiatives of the National Caregiver Support Collaborative, or NCSC, with you. Funded by the Older Americans Act, National Caregiver Support Collaborative provides greater recognition, support, and inclusion of the family caregivers served by the National Family Caregiver Support Program as established by OAA Title 3E. And the NACSP, as established by OAA Title 6C, as well as greater alignment with other efforts to improve supports to family caregivers. This collaborative includes the Technical Assistance Coordinating Center and 6 grantees focused on key family caregiving priorities that will support implementation and advancement of the national strategy to support family caregivers. Grantee and TAC collaboration and coordination is a cornerstone of this initiative. They convene regularly to ensure alignment across shared goals and identify opportunities for collaboration. This target audience of the NCSC is Older Americans Act Aging and Tribal Services Networks and applicable partners, such as area agencies on aging, state units on aging, local service providers, Title VI providers, Native Hawaiian organizations, kinship organizations, and disability service networks. This initiative aims to support several populations of family caregivers, including family caregivers of older adults, family caregivers of individuals of any age with early onset dementia, older relative caregivers of children, and older relative caregivers, including parents of adults 18 through 59 who have disabilities. The launch of the National Caregiver Support Collaborative marks a major milestone, as this is the first national scale capacity building effort in over 20 years, both for NFCSP and the NACSP. The initiative is designed to improve alignment between the NFCSP and the NACSP and other ACL initiatives to improve the lives of caregivers and care recipients. The 6 NCSC grantees and the Technical Assistance Coordinating Center have been developing actionable tools and resources to support the aging network, and we look forward to announcing many of them today during our event. NCSC grantees work collectively by sharing findings, research, and other critical data on family caregiving, which ensures grantees' insights help inform and advance each other's work, and also by identifying opportunities for collaboration and alignment, which maximizes impact, avoids duplication of efforts, and fosters cohesive action across the grantees. All NCSC activities are grounded in and informed by the national strategy to support family caregivers, which consists of 5 goals. Goal 1, increase awareness of and outreach to family caregivers. Goal 2, advance partnerships and engagement with family caregivers. Goal 3, strengthen services and supports for family caregivers. Goal 4, ensure financial and workplace security of family caregivers. And last but certainly not least, Goal 5, expand data, research, and evidence-based practices to support family caregivers. There are 5 NCSC grantees whose work aligns with one of each of these 5 goals. In addition, a 6th NCSC grantee's work focuses on building and enhancing the capacity of the aging network to offer effective caregiver navigator services in OAA-funded Title IIIE and 6C programs, and the entities administering them. The focus of the tax initiative spans all the national strategy goals. I thank you for joining us today, and I would now like to turn it over to Diana Caldwell, the Director of the National Caregiver Support Collaborative Technical Assistance Coordinating Center, to present an overview of their work. Diana?
Thank you so much, Jonathan. I am so excited to be here with all of you today and to share with you what the TAC is doing and how the TAC can support all of the great work that you are doing. I'm going to begin by talking about some of the different functions of the TAC. So, in addition to the great work that the grantees are doing, which you'll hear about shortly, the TAC conducts cross-cutting TA activities. So first, we are identifying and disseminating best practices related to caregiving and caregiver assessments. We conducted a national scan to surface best practices, and with our partner NASHB, we also conducted a 50-state caregiver scan. So we looked at what assessments are in use, how they're used, common themes in the domains that are assessed, and so on. And we're using this information to inform our technical assistance activities. We are also developing a Create Your Own Caregiver assessment for release next year. This is going to be a customizable resource for the Aging Network to promote use of caregiver assessments. And it will be flexible, and members of the Aging Network will be able to use the components of it that are most useful and relevant. So we look forward to sharing more information about that in the next year. Second, I mentioned using our scan activities to inform our technical assistance. So as a TAC, we are a TA resource for the Aging Network. In the next couple of slides, I'm going to highlight a couple of specific resources, but we look forward to providing written resources, events, and direct TA. Third, Jonathan mentioned the grantees, and you will be hearing from them shortly. As the TAC, we help to coordinate with the grantees and disseminate the resources they're developing and help to elevate the great work that they are doing. Finally, we are evaluating the initiative. So we're assessing the TA that's offered, the impact of the TAC, so that we can report on outcomes. All right, now that you know a little bit more about the TAC functions, I am so pleased to introduce to you the NCSC website. And here you can find information on key resources to support your work. You can learn about the NCSC initiative, you can access TA resources and grant resources, and you can request TA. So we just dropped a link to the website into the chat, and I do hope that you will visit it, bookmark it, come back often, because we are going to be adding new materials to the site regularly. So this is really your hub and your place to go to learn about the NCSC initiative. So I talked about our technical assistance, and I want to highlight a couple of things that are available for you to look at and coming soon. We recently posted a checklist for caregiver assessments. This is a self-guided resource for members of the Aging Network to examine their assessment practices and identify opportunities to enhance how they support caregivers. We encourage you to check back to the website soon for the release of a series of resources, including our Caregiver Promising Practices Spotlight series. And this features practices that were identified in our scan. We'll be sharing these practices, including links to resources and considerations for members of the Aging Network who might be interested in implementing some of these practices. So very actionable, succinct resources that you can review to identify practices and implement them in your setting. Also coming soon is our Caregiver Assessment Profile series. So this looks at caregiver assessment practices across the country and highlights promising practices and replicable strategies specific to assessment. So I just talked about our written TA resources, and let me touch on training. We will be offering more training events for the Aging Network, such as this one, in the coming months. These will be opportunities to hear about promising practices, emerging research, and strategies for supporting caregivers. We also offer direct individual technical assistance to entities involved with implementing and operating programs funded by the Older Americans Act. So as the TAC, we can provide tailored TA to states and organizations to improve upon and expand caregiver assessment practices or to identify and implement best practices. We just dropped some information in the chat. You can go to our website and the chat will direct you to how you can request more information about technical assistance if this is of interest to you. So please go to our website. You can subscribe to our mailing list to stay up to date on the latest TAC resources and events. You can be the first to know when new products are released or when we are planning an event. And we look forward to your continued engagement with the TAC, and we want to support and strengthen the valuable work that you are doing every day. I now am going to pass it back to Leah to introduce our grantee presentations. Leah?
Well, thank you so much, Diana. I appreciate that very comprehensive overview of the TAC. And we will now hear from each of the 6 NCSC grantees on their project objectives, their progress, and then some exciting opportunities for you all to engage with their work. So I'd like to welcome our first grantee representative, Cherie Kitt, who will be presenting on behalf of Community Catalyst on their work aligned with National Strategy Goal 1, Increase Awareness and Outreach. Community Catalyst project is titled Amplifying the Power of Family Caregiver Voices, a National Call to Action. So Cherie, the floor is yours.
Thank you. Hi, my name is Cherie Kitt, and again, our project is Amplifying the Power of Family Caregiver Voices. Again, I'm with Community Catalyst, a national health advocacy nonprofit based out of Boston. The goal of our project is to advance practice level changes by increasing awareness of family caregiving issues and enhancing the participation and engagement of family caregiver stakeholders in policy and decision making. The project objectives include partnering with 10 state family caregiver coalitions across the country. We support the state coalitions in building capacity, strengthening caregiver engagement strategies, and aligning local activities with national caregiver priorities. We do this through tailored training, one-on-one coaching, and resource development. Our next objective is to provide education and training that enables family caregivers and their allies to effectively share their personal stories, build skills for systems change, engage with decision makers, and raise public awareness of caregiving experiences. An example of how we do this is through our Lift Up Your Voice training. And our final objective is to identify and track best practices that emerge from our state-based coalition partners, including successful strategies, lessons learned, and innovative approaches to caregiver engagement that can be adapted and scaled across states. To date, we have successfully engaged the caregiver community through our coalitions, such as hosting resource fairs with integrated respite care, ensuring caregivers could be engaged and access is available for resources. Also organizing statewide caregiver conferences in both virtual as well as in-person formats to educate, engage, and empower attendees. We've also established a national steering committee that combines the expertise of nationally recognized professionals and individuals with lived caregiving experience, including sandwich caregivers and those caring for individuals with intellectual and developmental disabilities. This varied representation guarantees our strategies are informed by both professional insight and authentic real-world family caregiver perspectives. And finally, we conducted a baseline survey across 10 family caregiving family coalition states, garnering over 4,500 responses. The baseline survey provides a foundational understanding to tailor our education, engagement, and empowerment efforts to ensure that we reach caregivers and the aging network effectively. The data highlights that there's some gaps in awareness, particularly among caregivers who do not self-identify. And this will allow us to refine messaging and outreach strategies that will resonate more broadly. By sharing these insights with you all and the wider aging network, we hope to enhance your capacity to provide relevant information and services which align with our goal to educate and empower caregivers. Next slide, please. There are a number of opportunities to engage with us on this project. Participate in our caregiver video campaign by sharing your personal story. Our user-friendly soapbox platform makes it simple. Anyone can do this. All you need is a video camera and a microphone to get started. If you're interested in getting more involved with our state family caregiver coalitions, we encourage you to visit their websites. You'll find up-to-date information on how to join their coalitions or attend local events. And as I mentioned earlier, we have our Lift Up Your Voice training. The next training series will take place in August of this year, or you can work with us to engage in a tailored training that's specific to your population for groups of 8 or more. And finally, for those who are interested in additional information, you can find more information on our project page. You can visit the Community Catalyst NCSC project page. Thank you so much.
Thank you so much, Cherie. Those are definitely some exciting campaigns and opportunities for the Aging Network to get involved in Community Catalyst initiatives. And next, we will hear from Clara Park on behalf of the Regents of the University of California, San Francisco, or UCSF, on their work aligned with National Strategy Goal 2, Advanced Partnerships and Engagement. UCSF's project is titled Caregivers as Partners in Care Teams. So Clara, please go ahead.
Great. Thank you so much, Leah. Hi, everyone. As Leah mentioned, my name is Clara Park, and I'm the Director of Strategy for our program, Caregivers as Partners in Care Teams, or CAPCT for short. I'm based out of the Division of Geriatrics at the University of California, San Francisco, and the PI for this program is Dr. Anna Chodos, who is a geriatrician and clinical educator. And while UCSF is the lead site for CAPCT, our program would not be possible without the support from our wonderful partner organizations. That includes the University of California, Irvine, University of California College of the Law, the Brain Health Institute, and Archstone Foundation. As was mentioned, our program's focus is on advancing partnerships and engagement between family caregivers and healthcare teams specifically. Since the main audience for our program is healthcare team members, and we're talking about physicians, physician associates, nurse practitioners, nurses, social workers, and care navigators, our program really provides a very unique opportunity for Aging Network providers to partner with healthcare teams. We welcome and encourage you to consider how our program's free resources can help you work more closely with healthcare teams to engage with family caregivers and ultimately improve their health and well-being. So we have 4 main program objectives. The first is to develop multimodal trainings for healthcare teams on how to integrate caregivers into person-centered care using evidence-based tools and practices. The development of our trainings and resources are led by our wonderful education work group. And this education work group is comprised of practicing clinicians, lawyers, and other experts with many years of experience with clinical education programs. We also get input from other subject matter experts. As an example, we have a new course that specifically focuses on family caregivers who are grand families and kinship families. And for this course, we sought out input from the experts at the Grand Families and Kinship Support Network. Our second objective is to implement these trainings across clinical settings, including for hospitals and outpatient clinics. Our third objective is to disseminate these trainings nationally. And for dissemination, we're focused on building partnerships with various groups and organizations across the country, such as NASHP, the Center to Advance Palliative Care, or CAPC, and other state BOLD programs. If you or someone you know may be interested in our free resources, please reach out to us. I'll review all the ways you can get in touch with us when we get to the next slide. Our fourth and final objective is to evaluate the impact of our trainings on healthcare teams, including caregivers and care recipients. We're doing so mainly through post-training surveys and focus groups and interviews. Moving on to some of our program's accomplishments to date. We have built an entire website and produced a video that introduces our program. We are really proud to say that we have several caregivers who are actively involved in our National Steering Committee, and they're also featured in this video. We also created the Caregiver Training Services billing guides that are designed to help healthcare teams navigate reimbursement for caregiver training and education. This guide highlights the new codes around caregiver training services that CMS released last year. We also plan to update the billing guides to reflect the 2025 updates from CMS. And last but not least, we launched our core course called Foundational Skills for Engaging Caregivers in Healthcare, which is available in both a self-paced online format as well as a webinar-style live training format. We subsequently launched 3 supplemental courses that dive a little bit deeper into the topics introduced in the foundational course. All of our courses lean heavily on case studies and include live action videos to showcase real-life examples of how a healthcare provider or team member can identify, engage, and support caregivers. Next slide, please. We would love to hear from you on potential partnership opportunities or with any feedback you may have. We encourage you to take our trainings, all of which offer free continuing education credits. Please do share our program with others in your network who would be interested. You can also email us at capct@ucsf.edu. You can join our monthly newsletter, follow us on LinkedIn. And then lastly, we also have many more exciting trainings and resources that will be released this year. So please visit the NCSC website to find us under Goal 2. Thank you.
Thank you, Clara. Appreciate you walking us through UCSF's progress on all your resources and training courses, and even integrating the voices of family caregivers in your work. And joining us as our third grantee presenter is Kara Goldstein on behalf of US Aging, who will speak to their work aligned with National Strategy Goal 3, Strengthen Services and Supports. US Aging's project is titled Innovations in Family Caregiver Services and Supports. So Kara, you may begin.
Great, thanks so much, Leah. Hi, everyone. Good afternoon. My name is Kara Goldstein. I'm the Assistant Director of Caregiving at US Aging. And for those who are unfamiliar, US Aging represents and supports the National Network of Area Agencies on Aging and advocates for the Title VI Native American Aging programs as well. As Leah mentioned, we're working to address Goal 3 of the national strategy, which is to strengthen services and supports for family caregivers. And we're doing that through our Innovations in Family Caregiving Services and Supports initiative, which aims to enhance the capacity of the aging network to incorporate innovation, both during the development process and the implementation of services and supports for caregivers. And we have several main project activities and accomplishments we'd like to share, starting with the development of a Caregiver Services and Supports Action Guide series. This is focused on the aging network. Last year, we convened 8 different work groups and we contracted with some sub-partners to create these action guides focused on the intersection of family caregiving and the following topics: person and family-centered trauma-informed care. We partnered with Jewish Federations of North America. Respite care, we partnered with ARCH, National Respite Network. Education, counseling, and peer supports. We partnered with the Rosalind Carter Institute. We also partnered with RCI for the Emergency Response Planning and Preparedness Action Guide. Next, we also had a Social Determinants of Health work group and action guide. We partnered with the National Association of Nutrition and Aging Services Programs, NANASP. We have one on leveraging volunteers, which US Aging has led up. Future care needs, or long-term services and supports, we've also been calling it, is led by Family Caregiver Alliance. And lastly, kinship care is our last and final work group and action guide led by Generations United. So lots of partners involved in the project and lots of pieces being worked on. All work groups have done excellent work and completed their final drafts, which are currently under review at ACL, and we hope to have them available this summer. So stay tuned there. We've also launched a Caregiver Champion Collaborative. This is a virtual forum that facilitates peer networking for aging network professionals that specifically are leading caregiver services in their communities. We currently have over 260 professionals now participating, which has grown since the submission of these slides. So keeps growing. We're really excited about it. Those professionals represent a total of 45 states and as well as DC. So we are excited to see this group continue to grow and gain momentum. We also have been developing a Caregiver Services and Supports Innovations Hub. And this is going to be an online resource where aging network professionals can share descriptions of their family caregiving programs that are either innovative or evidence informed to promote replication in the field. We launched a call for submissions last fall and anticipate launching the full hub this summer. We've also been planning to fund some pilot sites to also encourage innovation in the field. We're planning to release a call for proposals to provide seed grants later this month. And these projects will focus on implementing new programs or scaling up existing innovative caregiving program efforts, specifically around the 8 topic areas that I mentioned earlier, which align with the action guides. Finally, we're conducting in-person and virtual conference summits. We've already held an in-person caregiving pre-conference last year at the annual US Aging Conference, and we're in the process of planning a virtual caregiving summit that will be held this fall. So I think we're ready for the next slide. So how can you get involved? We have a couple of areas where I'll put in the chat after I'm finished speaking. You can submit examples of your innovative caregiver programs to be included in the Innovations Hub. So I'll add the link to that in the chat, and you can also sign up to participate in the Caregiver Champion Collaborative, which we have a registration link I'll also include. And just stay tuned on the NCSC website, as well as the US Aging website for more information on our pilot site funding, as well as the virtual summit later this fall. Thank you for your time.
Thank you so much, Kara. US Aging has certainly been hard at work with all of your initiatives, and it's wonderful to see how much your Caregiver Champion Collaborative has already grown, and I'm sure there's going to be continued momentum there. And we're also pleased to have Donna Benton with us today on behalf of the University of Southern California, Leonard Davis School of Gerontology, who will share their work aligned with National Strategy Goal 4, Ensure Financial and Workplace Security. USC's project is titled Center for Advancing Family Caregiver Financial and Workplace Security. Donna, turning it over to you.
Thank you very much. We wanted to make sure that you understand what we're doing and how we can involve you in our programs. So our project of objectives for our financial and workplace security is that we want to make sure that by the end, we will have caregivers who can provide care without negative impacts to their near and long-term financial health. We also our goal is to have family caregivers really to have good access to employee-centered, flexible workplace policies and practices that really support that work-life balance that we so often talk about, and also have a professional performance when personal circumstances change. So we know that caregiving can go over the course of many years, and we want to make sure that people are able to understand that as circumstances change, we need to have flexible workplace policies. The other goal we'd like to have is that the family caregivers really have access to and use of financial education and advanced planning tools, which can help stabilize the caregiving for an older adult or a grandchild. Long-term care services and supports are more affordable, and they need to be more affordable during the time that you're providing care. And this will allow caregivers to reduce their out-of-pocket costs, which can be quite high over the course of caregiving. We want to, as far as our other objectives to achieve our goals, we really are, like everyone else, developing a learning collaborative of multidisciplinary experts and community partners who really help guide the project. So within our collaborative currently, we have both caregivers in our caregiver collaborative who look over all of the products that we are designing. We also are partnering with leading national organizations like Case Western, a high intensity group that includes many people throughout the nation, and employers, a group from the Benjamin Rose Institute, who are also looking over all of the products that are going to be developed through this group. So that we have these work groups and they review, they critique, and they help guide us to make sure that as we continue to have webinars and build up our website, that we will have things that will be used by you, the Aging Network, as well as being able to be used by the by the family caregivers. The other thing is during this time, we've developed a 13-member steering committee that includes members of the National Caregiver Support Collaborative, like U.S. Aging and Advancing Aging States. We started, of course, with an environmental scan looking at financial security and workplace security. And we'd like to see that, as far as our accomplishment, shared with you and other members so that you can see what is out there right now and we can begin to look for innovative practices. We will have an informational clearinghouse to disseminate this, all of the information we have, which will be on our website. So those are accomplishments. How can you be part of our engagement? We really want you to check out the summary of our environmental scan, which will be shared sometime during this summer. I want you to stay tuned for our employer toolkit that's going to be released again this beginning draft this summer and will be fully operational in the fall. And please stay up to date by visiting our website and, of course, the National Caregiver Support Collaborative website project page, which will make announcements and help you collaborate with us as we continue to build for this important goal of financial security. We really welcome your thoughts and ideas, and we really want to know what works and what doesn't, and what would be most helpful for you and your organizations and the Aging Network. Thank you very much.
Thank you so much, Donna. And the TAC has also observed a lot of interest from the Aging Network on this topic of ensuring financial and workplace security for caregivers. So we definitely appreciate you sharing those engagement opportunities. And next, we will hear from George Kippers on behalf of the National Alliance for Caregiving, or NAC, on their work aligned with National Strategy Goal 5, expand data, research, and evidence-based practices. NAC's project is titled Creating and Advancing Caregiving Research and Evidence Network. So George, the floor is yours.
Thank you. Hello, everyone. My name is George Kippers. I'm the Senior Research Manager at the National Alliance for Caregiving and a co-PI for the Goal 5 initiative, along with my colleague, Dr. Regina Shi at Emory University. Goal 5 of the national strategy is focused on building research infrastructure and expanding data and evidence-based practices in family caregiving by creating the National Creating and Advancing Caregiving Research and Evidence, or CARE, network. Our team is comprised of partnerships with researchers at Emory University, Marquette University, the University of Wisconsin-Madison, and U.S. Aging, and guided by an expert steering committee of leaders in caregiving research and services, as well as the community advisory board made up of current or past caregivers. Next slide. Our 4 key objectives are to first, develop a network of caregiving researchers, service providers, healthcare providers, and other stakeholders to share data, findings, resources, and practices. Second, develop a national caregiving research agenda aligned with the national strategy to support family caregivers. Third, to develop a learning program to create opportunities for Care Network members to connect, share practices, and identify needs for growth and development. And fourth, create a resource hub comprised of a matrix of caregiving data sources, as well as recommendations for evidence-based interventions and common measures for use in caregiving research. To date, some of our key accomplishments include developing a website to allow stakeholders to sign up to be a part of the Care Network, creating a first draft of the research agenda and soliciting feedback from internal and external stakeholders. Also not listed, but we did also host a webinar for caregiving service providers in order to solicit feedback on the draft of the research agenda. Additionally, developing and administering a survey to caregiving researchers and service providers to identify ways to promote engagement in caregiving research. And we also conducted and began conducting environmental scans and literature reviews to identify caregiving data sources, interventions, and common measures. Next slide. There are many ways that those in aging services and research networks can engage with our NCSC project, including but not limited to signing up to participate in the Care Network via our website, and also consider sharing the website with your networks and encouraging others to sign up and participate as well. Broadly, the audience we're seeking is researchers, service providers, healthcare providers, and other stakeholders interested in furthering the reach and impact of caregiving research on a national level. You can also use this website to stay up to date on additional opportunities to get involved, and a newsletter with more information is being developed to be distributed quarterly. Additionally, you can attend and participate in upcoming research and professional conferences, such as the US Aging Conference, which is July 20th to the 23rd in Chicago, and participate in upcoming Care Network events, including learning and peer networking events. You can also keep an eye out for the launch of several of our Goal 5 products and utilize and share them among your networks, including the Caregiving National Caregiving Research Agenda, which we're aiming to release in Q4 of this year, as well as items in the Caregiving Research Resource Hub, which we're aiming to begin launching in Q1 of 2026. You can also find more information about the Care Network on our NCSC website page, similar to as others have listed. And there you can also find the link to the Care Network website.
Thank you so much, George. Very excited for the launch of those products and the expansion of the Care Network, because like Jonathan mentioned earlier, this is definitely another really important topic that you all are working on. And concluding our grantee speaker lineup is Sarah Maloney on behalf of US Aging, who will present on their project titled Understanding, Testing, and Evaluating Caregiver Navigator Services. Sarah, over to you.
Thanks, Leah. Good afternoon, everyone. As previously mentioned by Kara, US Aging represents and supports the national network of 614 area agencies on aging and advocates for 290 Title VI Native American aging programs, and is leading a national effort to strengthen caregiver navigation services within Older Americans Act funded Title IIIE and 6C programs through one of the ACL's National Caregiver Support Collaborative's goals of understanding, testing, and evaluating caregiver navigation services. Our partners in this effort include Advancing States, the National Resource Center on Native American Aging, Family Caregiver Alliance, and Scripps Gerontology Center at Miami University. This initiative aims to improve the aging network's ability to help caregivers access the vital resources they need at the right time and in the right way. To assess the current landscape of caregiver navigation services in Older Americans Act funded programs, our team has conducted an environmental scan, surveys, and listening sessions with key participants across the aging network and family caregivers served by these programs. We're in the process of developing our funding opportunity for program evaluation sites. Data collected from these programs will inform the development of resources to facilitate widespread replication of successful models and approaches across the aging network. Next slide. We encourage organizations offering strong caregiver navigation services to connect with our team by contacting caregivernav@usaging.org. And caregiver navigation is helping caregivers access the services they need when they need them. In summer of 2025, we will be hosting a webinar to share these findings from our discovery phase. Also in the summer, we will be releasing the funding opportunity for program evaluation sites, which was mentioned earlier. So to stay up to date on our activities, you can visit the NCSC webpage and also US Aging's website.
Well, thank you so much, Sarah, for sharing about your team's progress and wrapping us up with those really actionable ways for the Aging Network to get involved and connect with your team. And thank you again to all of our grantee presenters for sharing such valuable insights and really those highlights from your project and your accomplishments so far. So you all can learn more about all of the grantees' work on the NCSC website, and the link has been shared in the chat a couple of times for you all. And we are now going to transition into our Q&A segment. So thank you so much to everyone who has submitted a question so far during the event. We're seeing a lot of really thoughtful ones coming in, and I encourage you to please continue to share those questions using the Zoom Q&A function that you can find at the bottom of your screen in the toolbar. And we also received some great questions in advance of the event. So to get us started with the Q&A, we've included a few of those questions we received here to address topics that we know are top of mind for many of you. So let's go ahead and take a look at our first question, which is how will the TAC help to address key challenges faced by the NFCSP and NACSP? So Diana, would you mind starting us off and sharing some insight in response to this first one?
Yeah, I'd be happy to. Thank you so much for the question, Leah. So I mentioned earlier that we conducted a scan of promising practices and caregiver assessments. And as part of that work, we held a series of listening sessions and interviews with members of the Aging Network. And through that, we identified key needs and areas of interest. So this included identifying promoting caregiver self-identification, administering strength-based caregiver assessments, expanding respite care opportunities, and offering caregiver-friendly workplace initiatives. Those are just a few examples, but that information that we gathered during the scan and through our listening sessions continues to guide our TA. By tracking and addressing your real-time needs and requests, we aim to provide responsive and tailored and actionable support to help you navigate these challenges.
Fantastic. Thanks so much, Diana. And we have one other question that maybe you can take on behalf of the TAC. So the second question we received is on the screen here. Can we submit TA requests that address the needs of a specific population or a specific region? So Diana, could you share more about the types of TA requests that the TAC is able to respond to here?
Yeah, absolutely. This is another great question. So any program responsible for administering an NFCSP or NACSP program is eligible to request TA. In some cases, partner organizations may also be eligible. Our direct TA is intended to support the needs of individual states and programs, and this could absolutely include requests for support that's tailored to specific populations or a specific region. And again, you can visit our website to request direct TA.
Wonderful. Thank you again, Diana. Appreciate those responses. So we also have received a few questions that are related to the grantees' projects. So I'll ask a few of you to respond to this first one. So we have, what are the most significant challenges in reaching and engaging the types of caregivers that you all support? So Cherie, if you could start us off by sharing some of those challenges that Community Catalyst has observed.
Absolutely. So, as you all know, caregivers face significant hurdles when it comes to engaging with support programs, primarily due to their limited availability. Our baseline survey highlighted this, with 60% of our respondents reporting difficulty finding time for their own physical and mental well-being. And when caregivers do have free time, they often have to prioritize their own health needs, making it difficult to engage in programs and/or events. And if they manage to engage, they often do it at a personal cost. Um, Furthermore, caregivers frequently operate in isolation, making it challenging to identify and connect with them. When connections are made, the varied experiences of caregivers, such as one may be caring for a child, another a spouse or aging parent, a one size fits all approach is often ineffective. So, to boost engagement, we focus on building trust through consistent support and personal connections through our coalitions. Examples include support groups for shared experiences to reduce isolation, respite services to free up time for caregivers' personal needs, as well as educational workshops on topics like digital and health literacy and self-care strategies for navigating the healthcare system while managing caregiving responsibilities. Thank you for that question.
Thanks, Cherie. That's really helpful and sounds like a great approach that you all have. And I'm wondering, Clara, if you could also weigh in on this one. Are there any challenges that UCSF is addressing that you could share here?
Sure. Thanks for the question. Again, our main audience is slightly different. So we're hoping to improve the lives of family caregivers by training healthcare team members. And as you can imagine, one of the main reasons why it's difficult for a doctor, for example, to identify and engage with caregivers is due to time constraints. They're faced with a lot of competing priorities to cover in a very limited amount of time with each patient. However, we try to mitigate these concerns by offering tools to guide conversations that hopefully make it just a little bit easier, and emphasizing that the steps of identifying, engaging, and supporting caregivers can and should be done over multiple visits and not just crammed into one, and is ultimately beneficial for the patient as well as the caregiver. Another reason why it's difficult from a healthcare delivery systems perspective is due to payment. Traditionally, all billing codes required the clinician to interact with the patient, him or herself. But this is where I'm really, really excited about the new caregiver training services billing codes, since this indicates a very important shift of recognizing the importance of working directly with caregivers. Hope that helps.
It does, thank you. Time constraints certainly seems to be a common trend here as a challenge faced by caregivers. So thank you so much for sharing those ways that you're helping to address that. And maybe if we could have one more grantee share for this one. So Sarah, what about US aging? Are there any challenges that you all have noted for this piece?
Sure. Thanks, Leah. I would say one of the biggest challenges in supporting family caregivers through the National Family Caregiver Support Program is simply reaching them. Many caregivers don't self-identify, echoing what Cherie said. They're just helping a parent, a spouse, or a friend, and they don't often realize that there is support out there that exists for what they're doing. And even when they are aware, caregivers are busy, they're juggling work, families, and the constant demands of caregiving, leaving little time to engage with services like respite training and support groups. And cultural and language differences, limited internet access, and rural geography can make access even harder. We also see emotional barriers, feelings of guilt, denial, or isolation that keep caregivers from asking for help. And once they do seek support, it's usually a crisis situation. So, really hoping that this caregiver navigation effort increases awareness about area agencies on aging, and the Title VI Native American caregiver support programs, which are available throughout the U.S. To support caregivers. Thank you for the question.
Thanks so much, Sarah. And I appreciate all three of you sharing those examples of the challenges that you've picked up on. And we have another question here for a couple of the grantees to potentially respond to. So what is one innovation to support family caregivers you've identified that would be easy to implement? So Kara, maybe we could have you share first on any innovation that US Aging has identified.
Sure, thanks for the question. I guess I want to preface my response by saying I'm not sure I would label any of the innovations that we've come across as easy to implement. All of these have, any programs have some challenges, and we're actually aiming to get some of those lessons learned out there through our innovations hub as those descriptions come out. So hopefully that'll be helpful things for the field to learn from. But one program that we identified that's implementing an innovative approach is the Caring Together Living Better program from Age Options, which is an area agency on aging in Oak Park, Illinois. It's a suburban community outside of Chicago. And this program is a faith-based train the trainer curriculum designed to meet the spiritual and supportive needs of African American and Latino family caregivers. And it partners with churches and community organizations and includes workshops on chronic disease management, and support groups for caregivers. It also offers activities like caregiver paint night and caregiver cafes, respite service, volunteer respite services, transportation, virtual activity nights, friendly phone visiting, and food distribution. So I think that just the variety and comprehensiveness of the program and the ways that it partners with trusted partners in the community have made it really successful and innovative. So just wanted to share that, and we're happy to share a link to that program as well.
Thanks, Kara. That's a great example. And it sounds like there's certainly elements of what that program is doing that could be easy to implement, even though they're doing quite a few different things there to offer to caregivers. And Donna, wondering if there is an example from USC's work that you could also share?
Yeah, thank you. First of all, let me say what Kara said. Nothing is necessarily easy to implement right now, particularly in the area around trying to get financial stability. And there aren't very many programs that we've been able to identify, but we're going to keep searching for those programs that are specific for helping financial security. But we are putting together an employer toolkit that can be used by the AAAs. And one of the innovations that we think are kind of somewhat easy to implement is to add caregiving related resources to existing EAP programs. And so these are very low cost where you can leverage infrastructure and you can have an immediate impact, because often the programs that are in place, they tend to overlook. What we found is they're overlooking the specific needs of caregivers, so that we can actually have referrals for caregiver support services, which we have through our AAA programs, financial and legal guidance that's related to caregiving, and that emotional and mental health resources that are tailored for family caregivers. So if you have if you use this toolkit for the EAP programs, that can be integrated. So that's one, I think, important innovation that we can do, along with, and I'm going to cheat here, is creating that culture of openness around being able to talk about caregiving and teaching people to feel comfortable being able to talk to their supervisors and coworkers about their caregiving. So we have to have policies that support and protect.
Fantastic. Thanks so much, Donna. That's another great example of innovation. And you mentioned low cost, which is a perfect segue into our other question here. And let's take a look. So the next question here is, what are cost-friendly ways that local aging networks can expand data, research, and evidence-based practices to support family caregivers? So George, I'm thinking this might be a good one for NAC. Do you have any insight from your work that you can share with us?
Absolutely, and thanks for the question. It's a good one. There are many ways, a number of which actually directly align with the work that we're trying to implement as part of our Care Network initiative. For example, first, collaborating with local universities, public health departments, and nonprofits can provide access to research expertise. Our Care Network peer learning events are designed in part to empower this collaboration. And also, our research agenda is designed to make it easy to identify priority areas of research. Another way is leveraging existing data, such as caregiver needs assessments, to help identify trends and guide targeted support. Our resource hub that I mentioned will feature several nationally representative data sets that will allow users to quickly answer questions and guide decision making based on data. Third, aging networks can use low-cost technology platforms like online surveys, community forums, or mobile apps to collect real-time feedback from caregivers. On this note, the Resource Hub will also offer recommendations for proven survey questions that you can use to consider for inclusion. And lastly, adopting and sharing open access toolkits and best practices from trusted sources like ACL will allow organizations to implement proven interventions without heavy investment. And identifying proven interventions is also a key element of our resource hub. So overall, with smart collaboration and resource sharing, even small networks can make data-informed decisions and improve caregiver support. Thank you.
Great. Thank you so much, George. Those are all some really good examples of cost-friendly ways. So appreciate you sharing. And we will now take some questions submitted through the Q&A. And I'm going to take a look at our Q&A box here. Okay, so for our first question from the Q&A, Cherie may be thinking that you could respond from Community Catalyst perspective. Could you please elaborate on strategies Community Catalyst has used for partnering with states?
Absolutely. So the state coalitions that we currently work with are Florida, Georgia, Idaho, Maine, Massachusetts, Minnesota, New Mexico, Oklahoma, Pennsylvania, and Tennessee. And our state coalitions are independent, but they often host monthly events and offer tailored resources. So even if you do not live in one of those particular states, resources like training or wellness videos can be incredibly valuable and are offered on their websites. And if you're local to a coalition, you might consider attending an event or reaching out to that coalition to just gain more information. And again, a lot of that information is directly on their site. I can also, connect anyone with one of our technical assistance providers here at Community Catalyst that can gather relevant resources and support that also might be helpful in terms of connecting you with any of our state coalitions. Thank you.
Great. Thank you so much for that added information. And we have another question here, kind of similar, perhaps for UCSF. So Clara, if you could think about a response. We have your program is uniquely situated to support partnership between aging network providers and healthcare teams. Do you have thoughts on guiding principles or key things to keep in mind when partnering with healthcare teams?
Oh, that's a really great question. I think I'll just highlight what I mentioned before about healthcare team members having so many different priorities and being pulled in so many different directions. So just being aware of all of these different priorities that they have and being mindful of their very limited time, I think is very helpful. And understanding that ultimately, most, if not all, healthcare providers really do have the patient's and the caregiver's best interests at heart. Anything that they fall short on is really, again, mostly around time constraints. So making sure that you emphasize how we can really help them in terms of understanding how they're dealing with these time constraints and giving them some very practical tools and resources that'll help them with these constraints.
Thanks so much, Clara. And while I have you, maybe a second question here for UCSF. So, healthcare providers supporting and engaging family caregivers is obviously helpful. Can you elaborate on the changes to the billing codes?
Sure, absolutely. So from my understanding, the billing codes in the past, they're all about healthcare providers working directly with the patient. There were no billing codes that allowed a healthcare provider working with the caregiver directly. However, in 2024, just last year, they did release a slew of new billing codes that does allow for exactly that. There are some codes around making sure that the healthcare provider can train caregivers, and there's a new billing code associated with those. And again, in 2025, there were some slight updates made to these billing codes. So we're making sure that our billing guide that's on our website is up to date, and we hope to make those updates by the end of this year.
Fantastic. Thank you so much. And Kara, we have one perhaps for US Aging. Someone asked in the Q&A about strategies to help caregivers self-identify that can be done with limited staff capacity. Do you have any ideas there?
Sure. I might tap in Sarah as well, since they've been having listening sessions around this recently. But so organizations with limited capacity helping caregivers to self-identify. I think a lot of, and also community, just from listening to Community Catalyst's work, talking in language that doesn't necessarily use the caregiver term, but talks more about, do you do these activities? And if somebody's answering yes, 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 take your mother to the grocery store type thing, then you would, qualify for these types of services. That's the first thing that comes to mind, but I think maybe Sarah or Cherie might be able to more eloquently talk about what some of those questions might be and what some of those easy ways to get caregivers to identify are.
Absolutely. And Sarah or Cherie, if you have other ideas, please feel free to chime in here.
Sure, I'm happy to jump in. I think I would echo what Kara said. I think it's a lot to put on someone to identify as a caregiver, but to identify the tasks that they're doing each day is a much simpler lift. So if you're looking on a website saying, yes, I do these things every day versus, oh, I'm a caregiver or am I caregiving? Those are very semantics, but it's a smaller lift for that person to identify, yes, I'm doing these things every day, and I could use some help in getting assistance with those, uh, daily tasks, daily ADLs, or maybe getting some respite. So I think, Kara, you were right on the money there.
Thank you, Sarah. Appreciate the response. Are there any other grantees who'd like to speak to this one about caregiver self-identification that could be done with limited staff capacity? Okay. Well, appreciate those couple of responses there. And I'm taking a look for any other questions in the Q&A or the chat here. I do see that we've had a few questions about when environmental scans and resources will be available. So there are a lot of resources that are close to being released in the next couple of months. So please do be sure to check the MCSC website regularly to see when those will be released. And we have that website once again in the chat for your reference. We also have a question for NAC. So George, are you able to elaborate on how folks can engage with your research network?
Yeah, absolutely. The first clear, easy step is visiting either our website, visiting our website, which is linked on our NCSC microsite. There's a sign up form there, and if you provide your information that will direct you to us, and we'll be able to invite you to participate in all of our upcoming events and additional opportunities to engage with the Care Network. And it also allow us to provide you with periodic updates on when resources are becoming available, specifically related to, for example, the National Research Agenda that's currently being revised based on feedback that I mentioned, and as well as those key pieces of the Resource Hub. Eventually, the Resource Hub items will be posted to the microsite as well, but we'll be able to provide you with more targeted time frames in terms of when each item will be available, such as the data sources matrix, proven interventions, and common measures to use in caregiving research.
Great, thank you, George. And we do have another question for you here. So with regard to research on caregiving, during Ray's listening sessions, there was interest in creating 3 or 4 standard survey questions on key caregiver issues and advocating for their inclusion in existing national data collection tools. So is there anything you can share about this?
Well, I'm not directly involved in that initiative. I do understand that this was one of the sort of guiding factors in our development of, one, collecting information on these nationally representative data sets. Part of what we're doing is trying to identify which measures are being used, and then cross-referencing that with the environmental scans that we're conducting across all of the literature, published literature, and even gray literature in caregiving research to identify proven measures. So identifying essentially which questions are recommended, not just in general, but also if you're working with a specific population or demographic, tailored wording for the questions. And those are all things that we're hoping to be able to provide clarity on through our data, our resource hub.
Great, thank you so much for sharing. And we have another question here for the TAC. So Diana, we've received actually a few questions that are really inquiring about best practices for family caregiver programs, or where Aging Network participants can learn more about assessment practices. So would you be able to summarize for the participants here how the TAC has and will be working to address this need?
Yeah, absolutely. That's a great question. Thanks, Leah. So we spent a good portion of the past year really focused on assessment. So before we were ready to jump in and deliver technical assistance, we wanted to understand what is happening, what is the current landscape, what are the promising practices, what are the needs. And so now we're at a point where we're starting to develop that technical assistance. So we are starting to push out some resources on caregiver assessment. I mentioned the series. So we're looking at different state practices, and more of those are going to be coming here in the near future on our website. I also mentioned the create your own caregiver assessment. That is not going to be released until next year. We're in the development stage of that, but that'll be a resource to look forward to. And then again, we are available for direct technical assistance. So if you have a particular need or a particular question related to caregiver assessment, I would invite you to reach out to us and, pose that question to us. The other thing I'll say is I'm watching the chat, and there are so many great suggestions of individual programs or practices, and so we may not be able to address them all today, but we are taking note of them, and we're going to look into each of those practices and consider whether it's something that we can incorporate into our work or address in our TA. So really appreciate everyone reaching out and sharing those practices in the chat today.
Thank you, Diana. And another common topic here is back to caregiver self-identification. So I'm wondering maybe Cherie or if others are interested in responding. The question is, based on your work you're doing with state coalitions, have you heard ideas for how to refer to caregivers, such as informal caregivers, unpaid caregivers, or just family who support their loved ones? Cherie, any thoughts from you about that one?
Yes, I think that's a great question. And I think I'm going to have a very short response because we are working with our coalitions around just kind of understanding, as I mentioned, different gaps. We did our baseline survey, but we're now also kind of reviewing that and following up with additional kind of questions that we have. And I feel as though this is one of those questions that we are seeking to find additional answers to so that we can support them in developing resources and how to identify with people who don't identify as caregivers, and what would be the most appropriate kind of like outreach approach, and if what's the terminology that they would be most comfortable with if they don't want to use the term caregiver. So that's something we're working on. So I can't directly answer that today, but I think it's a great question.
Thanks, Cherie. Glad that's something that you all are actively working on addressing. And before we move on, are there any other grantee speakers who have ideas about this question, about other ways to refer to caregivers?
Can I just quickly add something here?
Of course, please go ahead.
So we, again, from the healthcare perspective, refer to caregivers as caregivers. We did actually, in the beginning of our program, consider referring to them as care partners, but we really heard from caregivers with lived experience that they identify most with the term caregiver, so we've moved forward with that term. But referencing a related but different question about making sure that we identify the caregivers when especially they themselves might not identify as caregivers. We have a caregiver identification tool, again, for healthcare team members that'll hopefully be released on the NCSC microsite soon. But this tool is a one-page PDF that healthcare team members can use in terms of guiding their conversations with their patient and anyone who shows up with their patient. It has some questions that the provider can ask the caregiver that'll really get at the crux of whether they are a caregiver or not. And it uses various terms about, do you help this person? Are there other neighbors or friends that help this person? Again, recognizing that there may be more than one caregiver. So I'm hoping that this caregiver identification tool can be published soon and will be helpful for some.
Great, thank you so much for adding that, Clara. Is there anyone else who'd like to weigh in on that question before we continue? Okay, so moving on here, like Diana mentioned, there are quite a few nuanced questions in the chat that we'll definitely be taking back to inform our TA development and perhaps provide some responses to. So I'd like to encourage you all to continue to enter any other questions in the Q&A as we're working through our responses here. And for perhaps both US aging teams, we have another question here. In working with Aging Network and caregivers, is there a methodology you find most effective for engagement, such as telephone, conferences, or email?
I can hop in. I think it really depends on your geography and also who you're trying to reach. So depending on where you're located and who, for some it's telephone, if it's, older adult caregivers, or if you are trying to reach younger caregivers, sometimes social media outreach is the best way. So really deciding which demographic are you targeting and focusing your energy in that way, understanding because you can be anyone and be a caregiver. So I think they've really had to think through their different types of marketing and move away from some of the older styles of, just cold calls or, having a website that doesn't have Google Words or it needs to be easily searchable, easily accessible. Um, so yeah, depending on where you are, rural communities are very different than urban. So really understanding your community is important. I'd also like to, could I make one quick plug for a resource as well that I think might be able to help? So the Administration for Community Living also funds the Elder Care Locator, which is an excellent resource for caregivers in their community.
Thanks, Sarah. And Kara, I saw you come on camera as well, so I'd like to invite you to respond if you had something else.
Great. Yeah, just to piggyback on Sarah, I fully agree with everything that she said. I think one of the other things that we saw during and post COVID with all of the area agencies on aging, or many, was this switch over, or just in general in the world, switch over to virtual type services and people's comfort level with using that. And so I think just in general, there's a lot more platforms out there that are available for caregiver services and support groups and things like that. And so it's not necessarily an answer to the person's question of which is the most useful, but it's definitely, it has grown exponentially in terms of its use over just the past couple of years. So we know a lot of communities are using those different platforms.
Thank you, Kara. And I'm just taking a final look here in our Q&A box to see if we have anything else we're able to respond to live today. So I'll give it just another moment here to see if anything comes through. Okay. I think that those are all of the questions we're able to respond to live today. So thank you all so much for your engagement and contributing to the discussion with such thoughtful questions. And just a reminder that we are also recording all of the Q&A submissions that were sent today to review, and they will inform our future TA and training opportunities as well. So we can move to our next slide, and I just want to thank you all again for sharing your insights for our grantees and responses to these questions, and appreciate everyone attending today's training opportunity. The materials for this event will be shared on the NCSC website in the coming weeks, and please visit our website to stay up to date on forthcoming resources as well. For technical assistance related requests or questions, please email caregivercollaborative@acl.hhs.gov. And lastly, we encourage you all to fill out the survey that will pop up as you close out of this Zoom meeting. We would really love to hear from you about your experience at today's training opportunity and what topics you're interested in learning about more in the future. So thank you again for joining us today. We appreciate your time and your thoughtful questions, and we hope the information shared was valuable to you all. And we look forward to continuing to engage with you through this collaborative as we all support caregivers. So thank you so much and have a great rest of your day.